Today, I want to discuss my research on chronic obstructive pulmonary disorder, specifically using risk factor informed multi-omics analysis for key biomarker discovery and hypergraph-based machine learning for drug candidate identification and ranking. According to the World Health Organization, COPD caused 3.5 million deaths in 2021 and as of 2024 is the fourth leading cause of deaths worldwide. Treatments developed for COPD do not take into account each patient's unique exposome and how that contributes to COPD's complex heterogeneous pathology, primarily characterized by chronic bronchitis, emphysema, and other pathologies. So, this study uses network-based multi-omics data analysis to identify key biomarkers in COPD, and then uses that data in a random forest machine learning model to identify possible drug candidates for COPD treatment based on different risk factors. Starting with the multi-omics data analysis, this study focused on transcriptomics, proteomics, and metabolomics datasets. First, within this section, it was hypothesized that integrating risk factor multi-omics will improve the data structure as well as add context to COPD data. So the risk factors investigated included indoor and outdoor air pollutants, occupational particulates, and cigarette smoking. Additionally, the approach of adding biological annotation via pathway enrichment analysis was hypothesized to enhance network reliability and connectivity compared to only relying on biomarker-based data. For drug identification, a random forest machine learning model was employed, trained on PubChem data to identify druggable compounds, and the interactome data from the network multi-omics data analysis to identify the drug's direct and indirect impact on key biomarkers and disease pathways in COPD. This model predicts a global interaction score, which is then used to rank the most optimal drug candidates investigated from the PubChem dataset. Looking into the results, the TSNE plots shown compare integration of risk factors with COPD multi-omics data and solely COPD data on the right side. So, the first hypothesis was supported, as integrating risk factor multi-omics improves data structure as evidenced by dimensionality reduction with the TSNE plots. The next bar graph shows the number of nodes and edges with the pathway-enriched network and a biomarker-only network. And this bar graph supports the second hypothesis that employing a pathway-integrated interactome for the purpose of biological annotation will enhance the network reliability and connectivity versus solely relying on differential expression data from multi-omics studies. This next bar graph showcases the top 10 drug candidates identified from this study, showcasing results both investigated before in the context of respiratory disease and candidates that have never been identified in the context of respiratory disease before. This final figure is an interaction graph showcasing the cohesion of the study, showing interactions between risk factors, biomarkers, pathways, and drugs identified and explored in this study. These two tables showcase key statistical analysis elements. Particularly, I want to showcase the Cronbach's alpha between the pathway-enriched network and the biomarker-only network. Cronbach's alpha is a significant value greater than 0.7, which indicates the reliability of a data set. And the pathway-enriched network has a value of 0.85, whereas the biomarker only has a value less than 0.7 of 0.62. Some other key metrics include accuracy and precision of the random forest machine learning model of 0.9742 and 0.9506, respectively, showcasing the appropriateness of this model for pharmaceutical and clinical applications. Before I wrap up, I want to highlight some limitations. One key limitation is the unweighted impact of risk factors, as occupational exposures, such as secondhand smoking, versus direct cigarette smoking as a behavioral factor, can have different impacts in terms of magnitude and the genes or processes affected. So acquiring patient input data to develop a more accurate precision medicine model appropriate for clinical settings will increase the translational aspect of this research. Additionally, the drug identification model was based on limited availability of molecule biomarker interaction data. So using existing machine learning models to predict molecule biomarker interactions directly can enhance the drug discovery aspect of this research and make it more applicable in the pharmaceutical industry. Overall, this research poses an easy-to-use analysis pipeline for other multi-omic studies, especially in the context of diseases or environmental exposures, but also a potential precision medicine or personalized medicine model for clinical treatment of COPD, chronic respiratory disorders, and other diseases affected by environmental and behavioral risk factors.